Lindwe means a lot. A lot, 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 a lot. My name is Lindiwe Mdidimba. I'm married. I've got 3 children, 3 little girls, beautiful girls. And I adopted 2 boys from my sister-in-law. Both husband and wife died from HIV and AIDS. They keep it a secret until death. So I'm staying with these 2 children. I'm working at Health Promoters as a facilitator.
On 98.2 FM, we cover your airwaves like no other station.
Okay, without wasting any time, can I ask Obiso Vanjolo no George Araibe Pumapagwa health promoter, Besa Skaza Lukuti on Kanye health promoter, Manimbo Sandam Gallery, just Bandela Clash.
We do health education, specifically in the health professional shortage areas, like the townships. Where you find sometimes 1 doctor to about 3,000, 4,000 patients. And so we decide that why don't we give them an education which can bring awareness and help them to prevent the diseases from happening in the first place. So our motto is actually prevention through education.
There are things we just ignore in our lives, like, take care of ourselves, our bodies, and to, like, like brushing the teeth, lots of things. The people of Mfuleni, they are eager to learn. They are seeking for information, they are looking for information, and they go to the places where they can find information, more especially health information.
Kodwa health promoters lo uyakude. Singamdelela nje kodwa apha yakhona uyakude nyani. So ndithi hey angisazikhumbuli. Ngisazitanda ngifisa hey ndiyaguga. Sasikhumbula. Ona ngoba sabantu bebela kanena babantu basakhumbula.
We're not nurses, we're not doctors. We are just here to give the basic information. So we can help you by telling you maybe go and see your clinic, to advise them, go and see your doctor, go and see your clinic, so that you can get help. But then you can come back for the information, because the information is always good to have the information, so that if you've got this illness, you know how to treat it, and you know why must you keep on take your medicines. For example, if the person was diagnosed as diabetes, we explain to them what is going on in your blood vessels. So then it makes that person aware. It's an eye-opener for that person. And then they change their behavior. Then they start to look after themselves, and even on their families.
Nurse certificate.
Now, as a health promoter, working in Mfuleni, there is lots of requests. The crashes want us, we can't go to all of the crashes. We go to some of the crashes. So there are about 50 something crashes here in Fuleni, but we cannot reach there, all of them, because I'm the only health promoter here in Fuleni.
I learn how to help the children. If the children have got something wrong, I know how to do. After eat the meal, they brush the teeth. It's good because most of the children, they enjoy to brush the teeth, because at home they didn't brush the teeth. So at school, it is helping the children.
Here we learn them about their body parts. Some of them, they be abused even from the crashes. So they know, we learn them from the age of young that this is the private part. Nobody was put his hands in your private parts beside your mother. And if there's something that is so, we bring the mother and child close so that they can communicate to each other. Oh, I like work with the kids. And my thinking is that this is the mothers and fathers, or the generation of tomorrow. For me, if I could give the youngest one the basic information, I think they will grow up with it. It will be in their mind, so that tomorrow they can take it forward to their, even to start with their families, with their friends, and also with their own families in many years to come. So that will be a good foundation. If we can lay the good foundation, the foundation is strong, then I think the house that we will build on that foundation will be a perfect house.
Don't realize you need to wash your hands with soap, not just with clean water. Some communities don't have running water and toilets. Some are very lazy and don't know how important it is. Some don't have the knowledge of health, so they know nothing about this. In some communities, they don't have schools or like a center and to teach them about health. So that's why some of them are unhygienic. Thank you very much.
I feel that it's my passion. I like what I'm doing. If I help that person, I'm really full. I feel happy. I don't know how must I explain that. So it's sort of, we also build a relationship. We become, I don't know how to put it, but we become friends, we become a community that is united. You can help a person with a little bit of food, but if you gave them the knowledge, that is the biggest thing. So that person will stand up for themselves and look for something.